Good afternoon, everybody, and welcome to this IMI webinar on scaling innovations emerging from public-private partnerships. My name is Colm Carroll, and I'm a scientific project manager at IMI. And together with Magda Klebus of the FP office, I will introduce today's webinar. Before I do so, let me just cover a little bit of housekeeping on how we're going to run the webinar. So if we move to the next slide, you will see that you, the audience, are in listen-only mode at the moment. And what this means is that your microphones will not be activated throughout the webinar. However, we do very much want this webinar to be an interactive process. We really want to get the questions from you, the audience, so that we can address them in the discussion later on. So to ask us a question, please use the questions box in the little dashboard you have on the right-hand side of your screen. Now, this dashboard may be minimized. If it is, there's a little arrow at the top. Press the arrow and it'll open up and you should see the question box. And I would invite you to ask questions throughout the first part of the webinar so that we're ready to go and answer them in the second part. There's also a button there for you to go into full screen should you need to do so. We are also recording this webinar, and the recording and the slides will be available afterwards on the IMI website. So on the next slide is the agenda, but before I go through this agenda, I just want to have a quick word on what our aims are for the webinar today. So IMI as a partnership has been running for over 12 years now, and we are funding approximately 180 projects to date. And these projects have produced and are indeed still producing a wealth of information, wealth of knowledge, and also some very, very significant results. As an example, you may have seen that we recently published a bibliometrics report. We do this every year, and this year's one has recently been published. And this demonstrates some of the output of the projects in terms of publications, where some projects indeed are very prolific with hundreds of publications. However, this only tells part of the story. IMI projects also produce other very, very important results that could have a long-term impact on healthcare research, on drug development, and ultimately lead to better outcomes for the patients, which is what we want to do at the end of the day. So our aim today is to showcase the methodology to ensure that these important results can be scaled, can be sustained, with the aim of really having a long-term impact, which will ultimately deliver for the patients. So you can see on the screen in front of you the agenda for the webinar. So I'm going to hand over to Magda Klebus shortly, but I'll just go through the rest of the agenda before I do so. We have Lisa Linhout-Martin from the Forward Group, who's going to introduce this field manual, this Scaling Innovations manual. She will also go through a case study, and then, as I said, we'll open up to a panel discussion where we're very fortunate to be joined by two very, very experienced IMI project participants, Nigel Hughes and Kai Langell, who will also talk about perhaps some of their experiences on how to do this type of thing in IMI projects before I close off. So I will now hand over to Magda, who is the Executive Director for Science Policy at FPA, and to give her perspective and to give an overview on the field manual as well. Thank you.
Thank you so much, Colm, and thank you very much, everyone, for joining us for today's session. As Colm mentioned, today our objective is to give to all of you something very practical. That's why we do this webinar in the form of a masterclass with practitioners rather than a theoretical presentation of a document. Why are we here today? As Colm already said, the question about the impact of our projects and their results is probably the most frequently asked question. IMI has generated a lot of reports with independent reviewers on the impact of IMI, but as we know, some impacts might only happen if the assets, if the results of those projects are used in the first place. And that drove our reflection on how can we make sure that the results that we are generating are used, are deployed in real life. So it goes beyond the mere question of sustainability. It goes into application and implementation, and sustainability could be just one aspect of that. So what we would like to do today is to show you the result of our reflection, because we first started with collecting some examples and helping projects to define their path to scale or their deployment vision. And then we realized that these lessons can be collated and replicated in other projects and through other consortia. So today we would like to show you the result of that reflection, how to define a scale, how to plan for it, whom to engage with, what does that mean? And not only at the end of the project, this is where most of the projects start reflecting of what is our deployment or a scale-up strategy, but right from the beginning, from the planning phase. That's what the manual is about, and that's what we would like to go through with you today in a very, very practical way. So what you would hear, as Colm already said, is three parts: the manual, the case study, and the discussion. And we would like to encourage you to, throughout the presentation, to think about the questions that you would like to ask. Remember that there are no silly questions. There are only questions to which maybe we have no responses, but we would do our best together with the practitioners on the panel to respond or to provide some clues to all of them. There are only two rules today. Be active. There would be polls, there would be questions asked to you. We would like you to actively listen and ask any question or share any suggestion that you might have. It is now my pleasure to invite Lisa, already introduced by Colm, who is a senior partner in the Forward Group. This is a public-private partnership advisory firm based in Brussels. And we started collaboration with Lisa when looking at impact of different projects and ended up generating this field manual. Lisa is an expert in public-private partnerships, in business strategy, and in particular in health and digital. So as you see, one of the first practitioners today to present as the result of a broader reflection that took place together with different consortia in the context of IMI. So Lisa, the floor is yours.
Thank you, Magda, for the kind introduction. It's a pleasure to be here today with all of you, and a special thank you to IMI for hosting this masterclass. I think we can all agree that public-private partnerships offer tremendous value and have been at the center of many breakthrough innovations. That said, PPPs and the assets and associated impact coming out of them often face unique challenges when it comes to deployment and scale. And it's been my pleasure to work with many of the IMI projects to help them explore this challenge and to think about a more systematic way to approach it and plan ahead when thinking about deployment and upscaling. And I think the fact is that if we get this right, and I believe we can, the impact of IMI and IHI will continue long after the grants are closed. Next slide, please. And next slide again, thanks. Great, so here you see the field manual. And the field manual, why we're here today, was developed as a pragmatic tool to help IMI projects identify their assets and really provide a systematic framework to be deployed and scaled. You know, we wanted this to be really approachable, visually compelling, and easy to consume, and most importantly, easy to use. I think the field manual can really add value no matter where you are in the project lifecycle, and ultimately it can help you and your teams make the shift from a project mindset to an asset deployment mindset. And we iterated this tool, and it has already been used in proof of concept settings. And we'll hear a little bit later in this masterclass about a case study and from some of the practitioners, as Magda has mentioned. So we're delighted to have you with us today. But anyway, these are the real experts on how the tool works in practice and what they've learned throughout their own process. The other thing I'll say is that the field manual is fully customized to the needs of IMI and IHI. And we've combined some of the best private sector business strategy thinking with public sector scaling strategies for a custom hybrid model that's fit for purpose for IMI projects. This field manual has been presented to and endorsed by the IMI board and the FPA board and various subcommittees, including the scientific committee and the state's representative group. So to me, this really underscores the potential of IMI projects and the appetite to take them to the next level. So far there's been a lot of excitement around the field manual, as evidenced by the great turnout today as well. Now, before I get into the field manual itself, just a quick word on how it's been designed to be used. The field manual is high level, and you can decide at any point in time how deeply you go into each section. The aim is ultimately to get your project and your project team to think as early as possible about the scale-up pathway. So it's never too early to start. Next slide, please. And now we jump into, I guess, charting a course to scale. So at a high level, the field manual can be broken down into 3 sections. So that's scale-up vision, landscape scan, and scale-up pathway. And each feeds into the other sequentially. The scale-up vision is really thinking about this aspirational summary of what ultimate success looks like when you go to scale and when you deploy. What's the value? What's the impact? What do you want to achieve in the long term? What's the legacy that you want to leave behind? And then this feeds into the landscape scan, where you look at the area around you. It's really thinking about if the scale-up vision is fit for purpose, if it takes into account all of the ecosystem variables and leverages them. And there's then that feeds into the scale-up pathway. So the scale-up pathway is really this vision, and it's really the framework of how you reflect the findings of the landscape scan to ensure greatest likelihood of success. And within each of these components, we'll jump into detail further, but the scale vision is really about defining success, defining value in the target market, and defining the aspiration. Whereas in the landscape scan, you look at the drivers, the opportunities, the challenges, and the specific capabilities needed. And then that feeds into, under the scale-up pathway, thinking about ownership, structure, and mechanisms. So at the end, you have a very clear course charted for success. Next slide, please. So thinking about this, we wanted to interact with you and ask you some questions as well. Let's think about what can be an asset. Would it be A, new biomarker, B, a new method to assess value, C, a clinical trial network, D, a database, or E, all of the above? So please go ahead and click and place your vote, and then we'll take a look to see what your guesses are. Okay. Can we go ahead and show the results from that poll? All of the above, 93% of you. So the correct answer is in fact E, all of the above. All of these things are different types of assets, a new biomarker, a new method to assess value, a clinical trial network, a database. Just because it's not a new medicine or medical device, these are still things that can be deployed and scaled. Thanks. Next slide, please. Okay, so let's jump into the first module, the scale-up vision. We've already talked about how this is looking at the asset type. We talked about how this is an aspiration and a market and an impact vision. Well, that's new actually. So we want to really be sure when we look at this framework, we can walk it through left to right. And you see you've got colored lines here. So you can see that where you start, you can see where your path can be charted going through. And it covers first the type of the asset. So what type of asset is being considered for the scale up or assets? There can be more than one. Then the aspiration, what type of scale is envisioned and appropriate to enable that impact. Then looking at the target market, who will benefit, and the impact vision. What is the ultimate vision and for whom? I won't go into detail on all the specific definitions, but I will really touch on assets. I think that's really important. When we look at IMI projects, we can find 3 buckets of assets. The first is platform. And this is really a network of exchanges of information or services or goods. This could be a clinical trials network. This could be a data network. It could be anything along those lines. And then we have a product. This is an article or substance that is manufactured or refined or a service that is offered. And then lastly, but certainly not least, is knowledge, where there are findings, insights, or skills acquired through technical or process innovation. And each type of asset has a different aspiration or a way that it's taken to scale. So for platform can be adoption, which is expansion through recruitment and subscription of new users. So think of Uber or Facebook. It's a platform and you want to grow it. Then you also have for platform replication. So this is where you can take what the existing platform and recreate it or apply it to a new disease area or subject matter entity or geography. And then for a product, it can be replication or uptake. Uptake is really just using the product, so maximizing consumption of that asset. Whereas knowledge differs a little bit from the other two. You can use dissemination, where you spread information widely, but definitely strategically, or you leverage it. You use the knowledge to unlock other strategic benefits. And there are all a number of strategic considerations that you can ask after you've defined the aspiration. The target market includes the group that will benefit. So that can be patients, healthcare providers, payers, industry, regulatory and policy, research institutions, global health stakeholders, or advocates. And then really the impact will be defined by you in your project, but it could be really focused on the patient, the health system, science, industry, the world, or it might be a combination of several of those. Next slide, please. Okay, so let's jump into another question to test our knowledge. When speaking about scaling an asset, what is uptake? Is it expansion through recruitment and subscription of new use? Is it application to a new disease area, subject matter entity, maximization of consumption or use of an asset, the spreading of information widely and strategically? Go ahead and place your votes. Okay, and can we show results? Okay, so it looks like the majority of you thought the answer was C, and that's correct. The maximization or consumption or use of an asset. And this is used for a product. And it's really when you think about using that product, you're going to try to maximize consumption. The other answers would apply to the other types of assets. But great that over half of us landed on C. Thanks. Next slide. Okay, so we just walked through the first module. Now let's talk about the second module, landscape scan. So whereas the first module, we're really looking inward at our value proposition, our asset definition, our aspiration, the landscape, we're looking a bit more outward, looking at contextual factors. Now the landscape scan can be applied at 3 levels. It can be at the consortium, it can be for members, and it can also be at the ecosystem. And these landscape scans can be run simultaneously. So we have within this, when you look at either of those 3 levels, you want to look at 4 different factors of the landscape scan. The first is drivers, the second is opportunities, the third is challenges, and then fourthly, capabilities. And each of these are going to help you define what we call the DOCCs, which is the acronym there of those 3, but these defining factors of the landscape that's going to help you to be the most strategic and benefit the most in terms of deployment and scale. So we think about drivers a little bit. That's really things that could add momentum to your asset. It could be a champion that could drive the scaling up process by unlocking pathways and connections. Otherwise, that might be quite difficult. For example, with executive leadership, opportunities would be just looking for things that could make your asset go to scale a lot easier, just that you happen upon. It could be another IMI project that's working on something similar where you could actually join forces and work together for increased efficiency and scale. And then challenges, of course, will be things that if you leave them unmanaged could pose a threat to your scale up. And you really want to be aware of those and also how you're going to mitigate those challenges or navigate those challenges. Then lastly, in terms of capabilities, these are the skills and expertise needed to take the asset to scale. And one thing to keep in mind here, that the skill set for proof of concept of innovation is often quite opposite of the skill set needed to take an asset to scale. So that means really being aware of those key capabilities in terms of business development or government affairs that are going to be critical for beyond proof of concept, really into that deployment and upscale. Next slide, please. Okay, so let's review your knowledge again on landscape scan. So let's take a guess here. Joining forces with another IMI project to go to scale is an example of a driver, an opportunity, a challenge, or a capability. go ahead and place your votes. Okay, so let's see what we have. Can you give us the results, please? Opportunity, great. So 89% of you picked the correct answer. Indeed, that's an opportunity. It would be something that would be a positive force that you might happen upon, and so it wouldn't be a challenge. And capability is more about skill sets and having the right skill sets, and driver is a little different in that it's something that can really accelerate, such as a champion or other things. So it's it really falls heavily in that opportunity category. Great job. Next slide, please. Okay, so this is what we like to call the Metro map. And this takes all three modules together. You'll note that we've already been through, in figure 2 there, we've already been through the left side of the diagram. And the part that I want to focus on here is the scale up pathway, which is the part there over on the right. So we've already talked about defining our asset, the aspiration, the market, the landscape scan. And those are going to feed into the more calibrated or advanced pieces of your upscaling and deployment. And this is really important because we want to make sure that you have the contextual factor as well as from inside the project and out. And once those are set, we're going to look at ownership. So this is thinking about what level of ownership is required to achieve your aspiration and impact. And then if we look again on the top right, we look at the structure. What's the structure for this? Because we know that the grant will have to shift at one point to something else. What would that be? What's the structure? Then mechanisms, considering the way that it will be scaled and the aspiration and the market and the different drivers and opportunities and challenges and capabilities, what are the best mechanisms to use to achieve the strategy? And then ensuring at the end there that all of this will result and map into achieving that impact vision. So to add to this, I'll go through a little bit on the ownership structure and mechanism. So ownership can look really different for each asset, and it's really important that they're fit for purpose. So ownership can be, and it might look different than the consortium, and very well could. So you can have ownership that's centralized, it could be merged, it could be decentralized, you could have shared ownership, or even it might be appropriate to exit from ownership, but ensure sustainability and impact in the long term. And after ownership is defined, then you can look more at structure. What's the best structure for that ownership? And you'll see here again that each category feeds into the other. So, it is really providing this strategic framework. So it might be best in terms of structure to have for-profit, or might be a foundation or a nonprofit. And it's important to note as well that a foundation or nonprofit doesn't have to be donor-driven. It can have revenues as well in order to be self-sustaining. The other kind of next step there is having a social business or B Corp, which is a business that has specific social objectives and profits fund social programs. You can also have a DAO if you're working with blockchain. That's a type of technical ownership there. You can also continue in a public-private partnership. Or for knowledge, you can have a coalition. And then for all three asset types, you can have an acquisition or a handoff. So it's just whatever you do, there's not one right or wrong answer. It's just being sure that you make a choice and that it's strategic and fit for purpose. If you think about mechanisms, this is really the strategies and capabilities needed. And they can be licensing out, for example. So that's licensing the rights to parties to drive commercialization and generate financial payback. You can do an open license to others to freely use the IP and replicate and enhance the asset. And you can also use agile bespoke strategies. So these might be according to addressing and leveraging your drivers, your opportunities and challenges. And then you also have selective outsourcing, where you can select functions as required externally. So you might find the best expertise lies outside of the consortium to take you forward. There can also be synergies and then in-kind experience. And then just to repeat again that all of this, left to right through the Metro map, should result in your impact vision. Next slide, please. Okay, so you knew there might be a question coming, and here it is. Which type of assets are best suited for for-profit or B Corp? A, product, B, platform, C, knowledge, D, A and B, or E, B and C? I'm getting a little trickier here. Okay, can we see our results from the live poll, please? Okay, and 55% of you said D, and you are correct. So that's right. It can be a product or a platform for a for-profit or B Corp. We wouldn't use knowledge there because we'd want to hand off the knowledge and leverage it. It wouldn't really be fit for a business of any type, whether that's a for-profit or a B Corp. Thanks, guys. Great job. Next slide, please. Okay, so here we have, to wrap everything up, is a scale and uptake canvas. You might be familiar with a business canvas, and maybe you've used one in your project. And what this does is really provides you an area to take all of the ideas that you've generated as you've gone through the field manual and put them in one place. It's not meant to be an exhaustive strategy. This is meant to be a high-level guide to make sure that you have a working model and framework to continue your work. So you'll see there you have a place to identify your impact vision, your type of asset, your aspiration, your market, the ownership and structure. And then it gives you space to work through the mechanisms. And I think this is really important. So after you go through the landscape scan, you're going to have, you've got your DOCCs identified, your drivers, opportunities, challenges, and capabilities. So you might see that you have gaps there. In fact, you almost will, always will. So this is a place where you can list any gaps that come through to you or things that you want to follow up on from that landscape scan. And then it gives you space to identify strategies and capabilities required to address those gaps. And then, of course, we need to make it real and actionable. So there's a place to put a responsible person who will own that subsequent strategy. And that will give you really a map of where you sit. And that's something that can be started at day 0, and it's something that will change and you can easily come back to and iterate and evolve based on your progress going forward, but just really helps you to stay focused there on deployment and upscaling. Next slide, please. Okay, so last question before we jump into discussion. And this is really one for you to think about in your own projects. What do you see as the greatest challenge to scaling your asset? Do you see it as governance and ownership, financing, legal and IP, strategy development, or all of the above? Okay, let's take a look. All of the above. Interesting. I think that's really interesting because, and I think that reflects my findings and some of the other projects' findings as we were developing this field manual, that these are some of the hardest areas, and they all require this strategic thinking. So I think that the good news here is that the field manual can address each of these aspects to help ensure that you can have good planning there and success in each of those components. Great. Okay, next slide, please. Okay, so discussion. Now I wanted to go ahead and open up for discussion. We have about 7 minutes for discussion. So if you have a question you'd like to ask, please do type it in the chat field and I will see it and I will ask it and go ahead and hazard an answer.
Lisa?
Yeah.
Yeah, it's Magda here. While the questions are coming and where people think about the field manual, I think it's worth maybe for those who have missed the beginning to remind ourselves what are we talking about, because there is quite a lot of jargon here. So we are talking about what did I deliver, how it will be used, and by whom, what's the aim of having this asset used by others, who are the enablers who would help us with the use, and finally, what do I need to do to get there? I think it's important, and I see that some of the first questions are actually coming in.
Yeah, great. Thanks, Magda. I think that's really important to emphasize that and orient us as we're thinking about the field manual. I see, so first questions are coming in. So the first question says, what way would you recommend to identify opportunities for example, potential partners who are already running IMI projects? That's a great question. So I think for me, it's really looking at, once you have your asset and value proposition in mind, you'll know where you want to go. And so I would think of looking at other projects that could be doing something similar. So that might be, your current awareness. If there's something that doesn't lie in your current awareness, you might want to check out the IMI website. And then Colm, I'm not sure for you if you feel what the correct procedure would be from your perspective if someone wanted to reach out for more information on similar projects to them. But I think it's certainly important to think about because it's a great way to go more efficiently. Colm, did you want to add anything to that?
Yeah, I guess as you said, Lisa, I guess one of the starting points would be to look at projects which are perhaps operating in a similar area, look at those participants in those projects, and maybe identify those who perhaps would be most interested in scaling your particular asset and contact them directly would be my piece of advice on that. I've a slide or two at the end talking about other opportunities that you can use here, but I guess that's the main point. The other thing I would say is that looking to the future, I mean, this is not perhaps for scaling additional assets, but there are other partnering portals available to find people who are looking for funding. It's not the type of scaling we're talking about here, but there are portals available in the European Commission which could perhaps help you identify other partners as well.
Mm-hmm. Yeah, thanks, Coleman. One other thought came to mind for me as well, that I know one of the projects I was working with on the proof of concept for the field manual, they found a partner because they were looking at emerging regulatory guidance with the EMA, and they found another IMI project that had a similar goal, and they actually met in the context of these EMA discussions, but then they decided to collaborate once they both found they were working on the same thing. So I think it can be systematic, but I think the other thing to keep in mind is just keep your eyes open as you're going. And if you find another project as well, be pragmatic in that. Okay, we have the next question here. We want our project outputs to be sustained, but we need funding to do so. This funding has not been foreseen as part of the IMI grant. Have you got any practical suggestions on how to proceed and look for funding? So I think this is a really important point. It's a great question. I think it's really common in IMI projects from my experience. And I think that you can look for funding in a number of ways. So the first way would be to think about, once you have your governance structure set, does that include revenues? So does your asset have potential to generate revenues? And if so, that's the most sustainable funding source. So even if you have a foundation, you can be sustained by your own revenues. And I think that's in some ways harder to get going, but if you can get it going, it's the most sustainable. But even if you do that, you may need to have funding in the interim. And I think that's where you need to look at the landscape. From a practical perspective, I would say that would include foundations. So foundations in your area. So that would be one thing. But I think it's really important to try to think about, rather than going from grant to grant, really thinking about how it can be, how the, not project, but how the governance entity can be sustained over time. So those are some thoughts that come to mind for me. I think also there can be a scenario where venture capital can make sense too, in finding VCs. So but that would be a bit of the mix, and it is on a spectrum there. So from further grant funding from foundations to venture capital to self-sustaining revenue, I would list as the 3 buckets. And then which funders would be interested in you would of course depend on your asset and your disease area. But I could go on that one, but maybe I'll leave it there for now. Great. So I'll take one more question, and then I think we'll move to the next session already. Okay, so how does scope of scale up relate to the possibly more familiar term exploitation in the context of IMI and HE projects? So I think scale up and exploitation are really similar. I think what they're both after here is using it. So when you have an asset, scale up implies growing in scope and scale, and I would say exploitation means optimal use. So I think they're really similar, but they're both getting at this fact of we don't just create something and let it sit, we use it. So you think about it as an expression of, use the thing. Whatever the thing is, just use it. So I think it works both ways. And then I see that I have just 30 seconds left in this session, so I'll try to take one more question. What would you recommend IMI to ensure better flow of information between different PPPs and avoid replication of similar assets and PPPs, not using and building on each other's findings? That's a great question. I think that there's a wealth of knowledge out there in terms of the IMI website and what things are doing. And if I understand, I think there are some broader initiatives to ensure there is harmonization alignment of IMI projects, such as NeuroNet, which is a subset of IMI projects that can work together in the same space. So yeah, so I would check out those spaces to ensure that as well. Yeah, great. So these are some great questions. Thanks very much, everyone. It's great to be able to discuss. So let's go ahead and close the discussion on this, and we'll move ahead to the next session. Next slide, please. Okay, great. And if I didn't get a chance to answer a question, then I will try to find a way to follow up with you, perhaps offline, or maybe get it in one of the subs in the panel discussion. Thanks. Okay, so for the case study, so now that we have a good sense of what the field manual can do and how it works, I wanted to also provide you an example of how it has already been applied. So for this, I will walk you through a case study of Radar Base, one of the projects I worked with during the digital project. So in order to do that, I want to first present what Radar is, how it adds value, and a tool we created for them to show that, and then share how Radar Base approached the field manual. Next slide, please. Okay, so this is Radar CNS. Next slide, please. All right, so Radar CNS. Well, Radar CNS is about wearables to help predict and prevent relapse. It's a collaborative research program exploring the potential of wearable devices to help prevent and treat depression, MS, and epilepsy. In terms of how it works, Radar CNS, just like you saw in the picture, takes patient data from a wearable or a mobile device and sends it to the Radar platform, where it provides real-time analytics. And those analytics are then turned into patient insights. So there's analysis and data visualization of patient condition, and that is fed back to the healthcare specialists. So they apply and communicate those insights for better patient outcomes, and that goes back to the patient. What's interesting about Radar CNS is that there's also potential use for this intervention in clinical trials. And if you think about the value of that, it's tremendous. But really, if you boil it down, and this is what we worked on with the team, Radar CNS, the value proposition of Radar CNS is to improve people's quality of life and change how conditions are managed and treated. Data from mobile devices can give a full picture of a person's condition at a level of detail which was previously impossible. This offers the potential to detect changes in behavior, sleep, or mood before the individual themselves is aware of it, helping them to predict or even avoid a relapse, which is quite significant when you think about depression, MS, and epilepsy. So for MS, they really thought about and wanted to make sure that they gain an understanding of the disability, the disease course, and patient journey. And whereas for epilepsy, they wanted to track, predict, and prevent seizures. And then for depression, predict and preempt relapse. And you'll see here as well the key facts, the 22 partners at 26 million from 2016 to 2020, and all the logos of the partners there as well. Next slide, please. And we also did an exercise where we thought about Radar CNS and their aspiration at scale. We thought about their impact. And if you remember the field manual, we had all of those bubbles for impact, and we have here the patient, science, industry, and the world. And why does this matter? And really, for Radar, it boiled down to thinking about the future, predicting relapses before they happen. There's more than that, but that's really how they boiled it down. And if you think about the value to the patient, it's a new model for patient empowerment, enhanced patient experience, providing accelerated patient-centered care, better quality of life and outcomes, improved outcomes for epilepsy, depression, and MS, better physician and patient understanding, and even prevents hospitalizations and burden on healthcare and clinical system. I won't read through all the bullets, but I'll try to highlight a few of them in the interest of time and saving time for discussion here. But for science, it is a powerful tool for clinical insights and biomarker data for clinical trials, and can help with new guidance on the use of predictive biomarkers for disease. In terms of industry, you can see the potential for accelerated time to market due to smarter and faster clinical trials. And we see how digital technology creates new business models for growth. You know, when you have this platform, it's open source, it's open data, it's flexible, it's scalable, it's data-driven, and ensures data privacy, and can also be aligned to outcome-based care significantly. The beauty of digital interventions is that they can often be easily scaled across geographies, and here with Radar, it can also be scaled to other disease areas, including cardiac and stroke. Next slide, please. Okay, so back to our questions. It's quiz time again. Radar is a product, platform, or knowledge? What do we think? Okay, let's see the results. Okay, 64% of you are correct. It's a platform. So if we really think about Radar CNS, it's generating data that goes to a platform where we have analytics, and what's generated are insights. So that's would be what makes Radar a platform. Even though a mobile device can be used as part of it, still it's a platform at its core. Great job. Next slide, please. Okay, so keeping in mind that Radar defined their asset as a platform, we then stepped back and took them through the full scale-up pathway, which I'll share in a moment. But first, just want to emphasize again that they really went through this systematically to see the type of asset, their aspiration, their market, their landscape scan, and then further all of that feeding into the ownership structure, mechanisms, and impact vision. Next slide, please. Okay, so when we think about Radar, and given what you know about it so far, what would you say Radar is best suited for? Adoption, replication, uptake, dissemination, or leverage? Results, please. Okay, uptake. So 40% of you said uptake. So actually, in going through this process, Radar articulated they were best suited for replication, B. So if you said replication, you are correct. And the reason that they thought this was, first, it was a platform. So the options would be adoption or replication. And they chose replication because although Radar CNS was used for CNS, they thought if they looked at just Radar based on the technology, they thought that they could easily apply this to other disease areas. So they could create other platforms for other disease areas. So they settled on replication. Next slide, please. Okay, so if you look at this map, this is where we landed with Radar CNS after two workshops over several weeks, and might give you a little more insight into why they chose what they chose in terms of a platform. So, they are a platform. They are a network for exchanges with this information, as I was mentioning with the answer to the last question. They chose replication because they wanted to go to other disease areas, and they really saw their market as patients, healthcare providers, and payers in terms of research. So then they took those three factors into the landscape scan and came out with a number of gaps and also opportunities and drivers and next steps, which I'll show you in a second, and decided that shared ownership would be the best. The reason for this is that there were several academic institutions that were seen together as co-owning and working together in a foundation, and they really wanted to leverage the broader ecosystem of researchers within those institutions and even beyond to empower them. So they really saw ownership as shared. And then when we worked through structure, it became clear that a foundation would be the best structure for that, considering it was academic partners and shared ownership. And in terms of revenue generation, wanting to make sure that there was some, but realizing that there might be donor funding needed in the interim. And the way that they want to achieve all of this was through agile bespoke strategies, synergies, and in-kind experience, which would result in them achieving their impact vision of impacting the health system and science. And if we go to the next slide, we'll have a little more detail on each of those components. Next slide, please. Okay, so this is Radar-Base's scale and uptake canvas, and this is where they, after they went through that metro map and they have the map that we saw on the previous slide, they put all this information here, and this is their deployment and scale up plan going forward, and is their working draft to this day and guides their thinking and the decision making of the consortium. So Radar-Base defined their impact vision as establishing a niche platform of choice. They want to become established as the niche platform of choice for researchers requiring customizable real-world evidence. The platform enables large-scale studies and accelerates health research. And that's really the core of it. Of course, as we've said, that's a platform in terms of asset type. And the aspiration, again, is replication across different disease areas in those niche markets. They define their markets as primarily sponsors or PIs of large research studies. And they had a medium-term and long-term approach for that. So for the medium term, they want to look at clinical researchers who are doing real-world cohort studies in clinical settings with thousands of people. And they really wanted to be ambitious in the long term, and I think they really are on path to achieve this, eventually doing public health studies and citizen science studies with hundreds of thousands or even millions of participants. And you see how in that digital platform, they have ability to scale to that level. So for ownership, as we've discussed, it's a hybrid model of ownership, shared ownership. So with both focused leadership platform management of the academic institutions, but then also this broad engagement of the community of researchers. And for the structure, then just to repeat again, that is foundation, and they really wanted to have sustainability through revenue generation, and I thought that was really great, but have that catalytic transition funding from donors in the interim. So that's the left half of the canvas, and the right part of the canvas includes mechanism. So this is really a worksheet to map out the strategies and capabilities that are needed to fill the gaps identified through that landscape scan, and determine how to source your capabilities. This is how we ensure that the important things are addressed well and for success. So if I walk you through this a bit, we'll look at the outcomes from the landscape scan. First, they thought about articulating and defining the USP and target niche to address pressures in the healthcare system. So just to further elaborate on that and crystallize that a bit. And the strategy and capability required to address that would be market research on the target niche and further developing the value proposition. The responsible person there was the work package lead along with the consultant with the key capabilities. For the second mechanism was a business model expertise, really understanding how to sustain a revenue stream with a pragmatic plan. So the action there is to develop a business plan, and that would be led by a work package lead and in-kind BD expert from partner A. And of course, I've watched the specific names from this. So the third is fundraising for the short term until the transition to sustainable revenues is possible. And the strategy required is to explore donor funding options and a fundraising strategy. And that would be led by an external fundraising consultant collaboration with project leads. Fourthly, they really want to leverage the Radar data streams, considering the high volume of data here. Also included there are the proprietary algorithms, the database, in addition to the Radar base. So they wanted to create an additional asset development plan to ensure they capture the value from those assets that have been created. So again, multiple assets here. And that's being taken forward by a work package lead. Since this ownership is shared and requires robust community uptake, they want to really ensure that. So the strategy they wanted to employ in terms of that robust community uptake was identifying incentives for community growth. And that would be taken forward by a work package and in-kind community expert. So just again, to make the point that that's really targeted expertise there. And then they also wanted to consider other potential opportunities for Radar Base, just to make sure that really capturing the value. And they want to have a strategy for that that was really comprehensive business development approach to ensure they're catching everything they can in their development pipeline. That's being taken forward by a work package lead and an in-kind expert from one of the partners. And then lastly, but certainly not least, they really want to make sure they're set in terms of IP. Their data sets are not open source, and there were some potential issues that needed to be considered in the handover from the consortium to the foundation. So just ensuring there's a smooth transition. And the strategy there is developing a legal and IP framework that's being taken forward by an in-kind legal expert from one of the partners. Next slide, please. Okay, so question time again, but just to transition a bit. So that really gives you an idea of the canvas, how you can capture everything in one place and really use it to the specific needs of your project to make sure that you're focusing on the asset and what you're going to do with it in terms of scale. So we look at the next question. Let's think about this from your own shoes. So from your own perspective, what is the best time to start planning for scale? Before the grant application is submitted to IMI or ICHI, B, once the project funding is approved, C, halfway through the project, or D, after the project is finished. Go ahead and place your votes, please. Okay, let's see the results. Great, 67% of you said A, which is the correct answer. I would also say that it's correct to do the planning once the funding is approved and halfway through, but certainly definitely start. So this is going to be something that you come back to and will be iterative, but it's important to start before the grant application is actually submitted. So that's great. Well done. Next slide, please. Okay, so actually, if we could back up one slide. We are finished with the questions for section 2 there, and I wanted to take 5 minutes for discussion. So any questions on the case study, please go ahead and write them in the chat, and I'll be happy to address them.
Lisa, I would like to ask you one question. It's about the case study, because you've said about one solution. I think you've said this is about replication, but here we are talking about a platform that needs also to be taken up by the target audiences. So could you comment a little bit about, this was the choice of the consortium, right, to work more on replication, but in reality, they could be different types of scale up or exploitation or deployment in the context of a platform, and even in the context of this platform. Would you like to comment on that?
Yeah, absolutely. And that's a good point to explore a little bit further. So you could also go for adoption, where you wouldn't look at Radar chose to say, let's focus on a niche, but then also look at other niches. But you could take one niche and say, let's just go for adoption and work out from that niche and see if we can have broader adoption if we really throw all of our focus into that space. So that would also be a really relevant way to scale up in that scenario as well. And that really leverages the platform. And I think, as I've said, but just to reiterate that for digital platforms, they do lend themselves very well to adoption because they can achieve scale very rapidly. It's very easy to grow. So, if you think about, Facebook, something like this, it's really easy to add more users vis-a-vis a traditional product approach where you need to produce things or manufacture fixed items. So that's certainly something for consortiums to keep in mind who have platforms. That adoption is a really great strategy for scale as well.
Thank you for that. And I see that there are other questions coming, so let me facilitate that a little for you as well. Interesting that this does not mention competition, given that many companies are working in the wearable device for health, and also there are no regulatory approvals. But as far as I understand, regulatory was part of the project itself, right? So it was considered. So yeah. Happy again to hear your views.
Yeah, indeed. So regulatory is always really important, but that was already achieved within the project. So it wasn't an additional aspect to cover for scale. And the company really, Radar really looked at the wearable as well and explored, because they do have a device there. So that would be, a product. So there was potential to think about this synergistic approach with a product and a platform, but they decided that there's a lot of competition in that space for wearables, particularly if you think about a Fitbit or an Apple Watch, and it would be really hard to penetrate that market, and that was really outside of their expertise. So they decided not to focus on that aspect.
Thank you for that. And then another question is related to reconciling how Radar CNS reconciled being a foundation with generating revenue and having public institutions as partners.
Yeah, sure, great question. So I think that sometimes when we think of foundation, we think, that's funded by a donor, but in fact, a foundation can be funded by self-sustaining revenue. And I think for them, they saw that as a real opportunity in terms of the revenue potential of the studies they'd be generating, especially if you think about not only in their medium term, but their long-term vision, where these are very substantially sized studies. So they can do that. And so they thought, if we can do that, we want to do that. But we realized that we would need to have donor funding in the interim. So it's totally within the regulation and legal mandate of a foundation to be able to do that. In terms of control, they would have a board, so that would be part of its governance structure and a key component with representation from the academic institutions.
Again, I assume that everything depends on how you want your asset to be used in the future and what kind of structure it requires. So we are going to get to that in the panel discussion as well, no doubt. A question that maybe Colm can address: is Radar AD part of Radar Base?
Yeah, thanks, Magda. So Radar Base is actually the underlying platform that was a result of the Radar CNS project. But to answer also a question that came previously about how to ensure that the different projects build on each other and don't replicate each other, Radar AD is another project on Alzheimer's disease, and it is using the Radar-based technology for its studies as well. And indeed, Radar-based is also used by other IMI projects. So it's a nice example of how within the IMI framework we've managed to leverage this particular platform. But I guess Radar CNS and Radar Base are trying to go one step further, try and really get their scale up going so they can go outside the IMI family and really have that impact that we would want.
Thank you, Colm. There is one part of the manual, Lisa, that you didn't present today, but I hope that people who have looked at the manual would spot it, is the list of questions to ask at various times in the planning stage. And I think we would like all of you to go back to the manual and to flip through the pages and to find on the blue background the list of questions that can be asked at various times in your project development, in the planning phase, during execution, and even when you come closer to the project end. So maybe you can again refer back to that in the discussion, Lisa, because I think it was an interesting point of collecting those questions and making sure that they can be asked. Shall we move to our panel discussion and bring now on board the practitioners? I think those participants online would be very interested to hear from those who did that journey practically. And we have, in addition to Colm and Lisa online, also Nigel Hughes from Janssen, who leads on a number of projects, including Eden, and you might have heard about it, and Kai, who is also, again, from Janssen, a leader on digital strategies and digital projects, and is looking after a number of projects, but also about their exploitation. So let me ask the same question to both of them, coming back. What is your uptake, upscale, exploitation, maximization journey, and what points you would like to make based on today's conversation? Nigel, you first.
Okay, thank you very much, Magda, and thank you to Colm and Lisa. And I think this is an excellent development in terms of the field manual. It's actually something we've been waiting for, I think, in terms of focus on this particular area for some time, I think amongst a number of projects. So that's tremendous. And it's good that it's getting a launch today in this respect as well. I think just lessons from prior projects I've been involved in, and more latterly now with European Health Data and Evidence Network, Eden, I think we definitely need to almost go back to some of the basics here. And certainly for IMI and in the future IHI, kind of reconsider the context of the term project. You know, in terms of what do we mean in terms of these discrete activities that work under public-private partnerships within these programs. Certainly, I think going forward in the future, I think there needs to be a bit more prescriptive, to say the least, probably, about the type of platforms, processes, and inputs from prior projects. not to say that we're going to squash innovation, but I think, actually part of the asset continuity and sustainability on projects is about their uptake and use in future projects as well, rather than maybe reinventing the wheel or inventing new platforms and processes as well. So I think it's really important in terms of considering that for focusing on project asset continuity. So I think, as Lisa kind of pointed to, there may be elements or outputs that would survive from an original program, not just the whole program itself. And the sustainability needs to be part of the core attributes and outputs of the project beyond the IMI-IHA phase. And then it's more of a kind of startup mentality. So arguably, and this is what we've done with Eden, is we view ourselves as yes, we're a public-private partnership, we're within IMI, but we're kind of IMI funded. I think a lot of projects think we're an IMI project and there's a start, a middle, and then an end. And that's a big cardinal challenge and mistake, because actually the end should be much further beyond that, maybe years or even decades after the original program. So in some respects, this is a startup phase for quite a lot of projects, and they need to be thinking along those lines from day zero, rather than just in the application phase during the project. So there needs to be concurrent and parallel activity in the work plan. And I'm very pleased to see the result of the poll that at least 67% of people suggested it should start, even before you have your application in, rather than, in the middle or actually at the final year of the project, which is really too late. I think you were scrabbling around trying to address this rather significant issue. And I think the last few points are, so we're talking about public-private partnerships, public and the private financing. The knotty issue of return on investment on such approach needs to be kind of fully transparent, and the financing ought to be reviewed in the context of kind of early startup funding. So rather than kind of funding a project with an end, this needs to be viewed as, okay, have you met your deliverables of the project, but actually, what have you done in terms of longer term impact, and how is that measured in terms of the investment we've all put in, whether it's from IMI and the European Union or from industry, as it were, as we've seen to date. I think that's particularly important, and those outputs that need to be considered in kind of years or decades. It's only 5 to 10 years, bearing in mind that a lot of projects run for 5 years, say, on average, maybe less. You need to be thinking about longer term in that respect. So we're always entering into this. It's not again about short-term projects, it's about longer term deliverables, impact. And certainly I think in terms of, in that last point, I think in terms of considerable funding and focus to date within IMI and in the future with IHI, we need to ensure innovation in European healthcare impacts positively on patient treatment and care outcomes. And how can this be evaluated in terms of the impact of any one project and that investment? And that's probably a question that needs to be addressed in the application phase for any future project, in terms of, well, okay, so you're going to do X, Y, or Z, but what's going to be the real world impact of that, and how are we going to measure that in terms of the impact on European healthcare, which is ultimately, I think, why IMI and IHA were created in the first place. So thanks for those moments, but just a few points from me.
Thank you so much, Nigel. Yeah.
And if I can carry on from what Nigel said there, and just to clarify one point. So Nigel, when you say day zero, you actually mean a different day than what most people would have in their mind, because the big masses of people will actually join when the project starts, and to them that is day zero. What you're really saying is that the thinking needs to start at day minus 200, because by the time the day zero comes around and the project actually starts, it's very hectic times in the projects to get everything off the ground, all the new people moving in the same direction. That is not the right time to think about this impact and sustainability. You're going to be thinking about everyday things to get everybody understand what the project is all about, what we're supposed to be doing.
Yeah, what I would say there, Kai, is that for Eden, we started a year before the application process. So when I say day zero, I'm talking about, not day one when the project starts. I'm talking about before that. But certainly for Eden, that was a year before we started.
Yeah, that is your day zero, but to most of the people joining the project, day zero, their day zero is actually much later. So what we're talking about really is like day minus 300, day minus 200, whatever, well before the project actually starts. What I really liked about your toolkit and presentation here is that you also talk about the skill sets required to do this kind of work. There's a reason why academic institutions have a tech transfer office. For that same reason is that the people actually doing research might not be the best people to actually commercialize and take some of these innovations out to the world. So that's why they have created a specialized office where they have the right tools, the right people to make that sort of connections to the world. So what we could also think about is that what could the IMI, IHI tech transfer office look like, where some of these right skills would be available, where Lisa would be sitting at that office, or people like Lisa who have this sort of expertise, that have the right kind of tools that can then help these projects do some of that. Because quite often the project insiders, they don't have a lot of those skills. So your manual might not go all the way to actually achieving the impact if we are missing some of those soft skills to actually do the work. So that's maybe something to think about in the future. How can we better support this project with the skills? But your tool, I think, will go a long way, because I remember from my own IMI projects where I wanted to develop a bit of a sustainability and impact discussion, and I had to come up with my own templates and kind of start to construct this, and it took a lot of effort from me, and I'm somebody who has some of those skills, so it was quite difficult even for somebody like me, and I can imagine how difficult it is for some people who don't have that. So I think your templates and that structure really goes a really long way. But I think what's really also important is the sort of mindset that people need to have in this project. So these projects are not about doing the project. These are about the legacy that this project will leave behind. So once the project is over, why should anybody care? What stories do we have to tell our children and grandchildren about things that we have achieved? So that's really the legacy mindset is something that we need to really install into people's minds so that they think about that day to day, and they should feel proud about their achievements or results well after the project is over.
Thank you, Kai. And I'd like to turn to Colm, because I think you've witnessed a lot of the conversations in projects about how their assets would be used, or rather, first and foremost, projects mind about how to deliver the outputs that they are supposed to deliver. How often and what are the difficulties of bringing in the conversation about how the assets would be used later? Is that a question of project objectives? Is that the question of how they are structured? What is your view and advice you could give to projects in that space?
Yeah, thanks, Magda. So obviously I said at the start, we've funded 180 or so projects to date, and many of those have already finished. And many have actually already had assets which they have found sustainability pathways for, although it has always been a bit of a struggle for them because, and we've touched on this quite a lot already, they come a little bit late to the discussion. It's not embedded at the very start of the project or even before. It comes to a bit late. So it's always been a bit of a struggle for them. However, there are successes, and I guess perhaps what they have done, which has helped them with success, is to realize that an IMI project, the consortium involved is generally very, very broad. And Kai touched on skills there and the importance of having the right skills. Sometimes the skills are available in the consortium, but perhaps they're not available in the organization who has been central to developing the particular asset. So I think where projects have been successful, in some cases they have leveraged the skill sets within the consortium, not just stuck to their own little, their organization or their own little niche area of their project and gone a bit broader. I'm thinking in particular those projects where perhaps there are small startup companies already involved who have that expertise and have the drive to get things going. So those projects who are on the call now, who perhaps are perhaps later in their progress, could start thinking of leveraging what they already have. And in other cases, projects have successfully managed to interest external companies. If they've got a particular asset which is maybe sometimes a little bit niche, but there's some external companies who are interested in, they have engaged directly with them. And this is not it's not perhaps the template which we could rely on for scalability across all IMI projects, but sometimes if you can identify one or two niche organizations who have an interest in what you're developing, and then you can do some sort of licensing arrangement with them. And then perhaps the third, and I'll stop here, is the third kind of model that I've seen coming from a number of IMI projects is actually a spin-off themselves. And these are perhaps people, quite often academic, from the academic side of the consortium, people who have an interest, perhaps a personal drive or personal interest in developing an asset themselves, have spun off an organization generally centered around one particular result. And yes, it is difficult. They have all these struggles of identifying the right funding, identifying their end users, their customers, essentially. But in certain cases, it has worked. And our advice on this to projects is always to try to do this earlier in the project rather than later, so you have the cushion of the public funding to get you going before you're really thrown out to yourself and have to rely on your own funding.
Thanks, Colm. I think, as Lisa said at the beginning, there are two sort of big questions. The first one is, what is the scale and what is the vision of scale, which means how the asset would be used in research practice, in regulatory practice, in medical practice, etc. And the second is how to get there. I'd like to turn back to Nigel and Kai, and especially somebody mentioned the word regulators or payers or healthcare systems. How did you, in your project, actually think about both scale and then who were the ones who would enable getting to that scale? I don't know who would like to start.
Well, if I may, I suppose, certainly, well, I think just a couple of quick examples, maybe, I suppose. Well, first and foremost, I just want to pick up on a couple of comments from Colm. There's one good example, I suppose, of seeing this through to maybe kind of acquisition, and that was electronic health records for clinical research, GHR for CR from IMI1, which, to cut a long story short, created a sustainable platform, but then was acquired actually by a commercial entity and so forth, and that gave them their foothold in Europe, and that's the kind of sustainability in one of its avenues, I suppose. The second thing is just that aspect about funding, which has been mentioned a number of times in this session, and there's been papers written on it too as well, of course. But one of the key things is that diversity of funding, I think, is kind of critical. Still remaining and looking into the fold, and particularly from pharmaceutical sponsors, many of whom have already been in the project and are being asked to continue to add funding and so forth, has its own inherent challenges. So I think looking much further out to other sources of funding are really important. And then lastly, I think within Eden, some of this comes down to actually, and it comes back from Kai's comments earlier about whether or not you have the relevant skills and knowledge, within a project to see how to make something sustainable. But actually, it's no different to an IMI project, IHI in the future, or a startup, or any kind of entity which is creating a product, service, platform, or whatever, which may have actually, you're effectively, quote unquote, selling to. If you can't create a customer base, or there doesn't seem to be perceived need, you're in trouble. So not to be too facetious, but so I think certainly for us, in terms of Eden's an infrastructure project, we're growing a very large scale network for data harmonization, but more importantly to support evidence generation at scale. And there's a clear unmet need in Europe for these types of approaches. And critically, again, stakeholder engagement needs to happen before even the project starts again. You need to work with those that you'll collaborate with in a project, seeing them also as potential users of your product, platform, or system, or application, or whatever. And you need to view them in that way, partly because that's who you'll be engaging with in the future, post-IMI or similar public-private partnership. But more importantly, also, they need to feed in to what's being developed. So it comes back to an earlier comment I think you made, Colm, about not just being within the project and looking to others. Quite a number of people are not in Eden's consortium, for instance, but that shouldn't matter. There are ways and means of incorporating input, engagement, and commitment from stakeholders like regulators, payers, and many others, as it were. And that's really crucially important. So again, you have to think wide and beyond the scope of the project and understand where you want to land in however many years' time, who's going to influence that, and who do you need to work with, and how will they shape what it is, the end product that you're designing or developing, that will ultimately meet their needs. Because if it doesn't, they won't support it, they won't pay for it, it will not gain a market.
Indeed, and that gets me to Kai, because we were talking a lot about, for example, digital endpoints and how to get them to be used in practice beyond a project. I don't know if you want to comment on any of that.
Yeah, well, I want to comment on your previous question as well. And there's these consortia actually carry a lot of weight. First of all, they're very diverse, they're often very large, with number of pharma companies and other parties in the mix. So people will listen to these consortia for sure, and that can contribute to the impact and to the legacy that they leave behind, without necessarily actually delivering a tangible asset that needs to be sustained. But let's not kind of forget the impact on policy and these kinds of things, where these projects can start important conversations and then can influence important things. And as an example, the Trials at Home consortium that's focused on decentralized trials, they went through the EMA Innovation Task Force engagement, and the EMA coordinator said that this is probably the biggest regulatory gathering they've ever had, where we had like 75 people on the call with 55 regulators on the phone. So clearly a key topic of great interest to them across Europe. And that engagement then led to follow-up conversations with some of the national regulators on these topics. So that is much more impactful than individual companies trying to do something like that. That is not always something that we think about in advance in the project plans and all of that. Sometimes we have to just take these opportunities as they come to us, as the world around us evolves, and as the project also evolves. So that's an important part of the impact there as well. Digital endpoint is one of these areas where this kind of work is really required. And the same thing with decentralized trials. These are new topics where the regulators are trying to find their way, and they want to be informed about what the needs are, the barriers, challenges. And then I think they would much rather work with a consortium like this rather than with having to engage with 50 different companies on the same exact topic. So IMI and these kind of projects give us this broad forum to initiate conversations and do things like that. So I think that's a really important factor of these kind of work that we don't always talk enough about.
Thank you. And getting out of the project into the real world in whatever shape and form, it's really what we are talking about and what is the purpose of this field manual. And your point, Nigel, about what is a project and that it is an entity with a beginning, a middle and the end. And then what's important is what happens besides that and who is engaged is an important plan. So what is the biggest impediment for that, and what people should be thinking of in order to make that happen, to get from project logic to real world?
I mean, I'll pick up on, there was a comment you just made earlier, Kai, about these consortia are very important, and they are. I couldn't agree with you more. But actually, that size thing is very interesting. I think you mentioned they can be quite large. I think for certain projects we've seen success, I think, because they're smaller. They're smaller consortia, and they're more agile as a consequence. I think that's really important in terms of how you pick consortia members. Aside from the industry partners, it's again, if you're thinking longer term, and if you have a different mentality in terms of you go into what quote unquote is a project, you may actually pick a different consortia, or at least some constituent members of that consortia than you may have done in the past for IMI projects. And I think that's worth recognizing. I think also, I think certainly the point I was trying to reinforce, I suppose, is not to consider an IMI or IHI, public-private partnership funding, to be a grant. Don't think of it as a grant, which is a means to an end ordinarily, for a piece of research, for instance, which is well prescribed and well defined, and then stops and then maybe allows you to get on to the next stage and so on. And I think that's some of the challenge we've had to date, is that you go in with a thinking there's a finite end. And that's not to say that that may not be the case for certain projects, and it might be completely appropriate. And there may be only certain assets that need to be continued beyond that. But if we are wanting to see very large scale, operational, if you like, sustainability beyond what we see today, you need to actually change mindsets as people go in. They need to be thinking differently about, oh, well, I'll do this for 3 years or 5 years and then it's ended. If you go in with that already, you're already failing on sustainability, because you're not even thinking about, you're just thinking about the end goals of a project as described by the deliverables we need to respond to, and anything other activities we have in the description of action. If you're starting a project tomorrow and it will end in 5 years' time, what you really need to be thinking is, where am I in 10 years? That seems a long way out. It's incredibly difficult to predict. But you need to have a much longer term mentality. And I think that there needs to be some shake up, if you like, in the mentality if you go into this, and the design and the configuration of consortia accordingly.
Yeah.
Maybe just the kind of getting out into the world. So quite often I think these projects are set up with one work package dealing with communications, and all of that is kind of put into that one silo. I think all of the different work packages and groups should be thinking about communications and stakeholders that they want to engage with, rather than that being put into one silo. So maybe the structure of how that kind of thing is done is a little bit wrong. I think projects should identify ambassadors that would take care of certain activities or stakeholders, to make sure that we really take more of an extroverted view into the world, rather than only caring about what happens inside the project and all of that. But I mean, communications within a project with like 200-300 members is already a challenge. But I do think it's really important that they also think about external communications and engagements, and that is not only centralized to one function within the project, but is something that's in everybody's mind.
Yeah, I still think that 200-300 members is too big. I really do think the consortia for some projects to date have just been too large. And a previous project like EMIF, European Medical Information Framework, was huge and extremely difficult to manage. And actually that saps a lot of operational energy and resources while you're doing it, which otherwise you'd probably have focused on, other types of communications, external or otherwise. So yeah, I think that's a point to consider too.
Irrespective of the size of the consortium, it is important that we have the people who would also help us the scaling up and the exploitation in the future, right? So as much as possible, when thinking about a project, it is important to think about the vision of uptake, who would be using the assets, how it will be used, and then as much as possible bring in those who have the key to unlock this possibility to use into the consortium. And I think, Lisa, that was one of the key lessons from the field manual, wasn't it?
Yeah, absolutely. It really is about having the right capabilities and the right skill set. And if that's not in the consortium, well, first, ideally it is, but if not, then bringing it in, just to make sure that you have the right expertise. And oftentimes, like we said, the skill set required to take something to scale is quite different than the skill set required for proof of concept. So I think that's really critical. And I think as well, you're just underlining the point that's been made is just to start. So really it's just to take a step and start, and it can't be too early. And I think that as well, the mapping, get information, and then, just so that you're not surprised by it later. And if you get the information, if you map, then you can make a strategic decision, and you can have the right skill set and capability included that will make sure that you use the information strategically and well. So, and I guess the other thing I would add to that is that the process, it might be iterative, and it will be, and that's okay, and it will change and it will evolve, but just making sure that you have the place for that and you're planning to revisit, and again, the right skill set to help you navigate through, I think will set you on track for success.
So I think if I may just, before we hand over back to Colin for the wrap up, to say, please ask yourself the question on how my asset will be used and by whom rather earlier than later, so that it can be planned and the scale up can be planned as a part of the process in the project, rather than towards the end when it takes everyone by surprise. And then the field manual is there to help. With that, thank you very much, colleagues, for this interesting discussion, and I hand over to Colm for some concluding remarks.
Thank you, Magda, and thank you, Nigel and Kai as well, and Lisa for your input on that. Great to have some input from people who are at the coalface working on these actual problems. I think everything that I wanted to say in my concluding remarks has already been mentioned, but just to give kind of a recap on that, I think one of the most important things we've realized is to start early thinking about what is an asset and how am I going to scale it? How am I going to make sure this asset has the impact I want? Now, obviously, it was mentioned that the sooner the better, even before the project starts, is ideal. Not everybody has that possibility now, but it's never too late. It's never too late. So I would really encourage those of you in projects to start already. There's a big element of mindset as well, and I think Nigel touched on this quite a bit. It's moving beyond thinking of a project as a fixed timescale event, and when you finish the project, you're finished. It's really thinking long term. How can you make sure that what the project has generated can feed all the way through to having that impact, ideally on the patients in the long term. So really thinking about that. And part of that then is thinking about the immediate end users of the result of the project. Who will be wanting to take it up? Who would be willing to invest in it? So think about those all through your project lifetime. We mentioned the importance of having the right skills. Maybe it's in the consortium, great. Maybe it's not and you have to get it in, but that's again something essential really to work your way through. And I have a couple of slides at the end about support you can get. This is to answer some questions we got in the chat. But before I move on to those, I just want to talk a little bit about the future of IMI and IHI, which is mentioned a couple of times as well. And it's clear, those of you who follow Horizon Europe generally, it's clear that the direction of travel is very much along the lines we've just been speaking about: long-term sustainable impact and impact outside of the consortium, impact even outside of the immediate area of the project. So those of you who are well positioned to think about this already now are well positioned to be able to make a very good contribution to Horizon Europe and IHI when it really gets going. So I have, we're not alone in thinking about these problems in IMI. I mean, the other European funded programs are also trying to address these. And I have a couple of slides here about some support which is available to Horizon 2020 and IMI projects more generally. Now, I don't want to get your expectations up too high. This is still, some of these are still in the pilot phase, but I think from your point of view, it's very well worth exploring these. The effort that's needed from your side is quite low. The first one I'll mention here is called the Horizon Results Platform, and this is about results, so tangible, exploitable results. The aim here is to, it says here, to widen exploitation opportunities. So it's directly addressing what we want to do here, but it's also all just about displaying the results of your project to the greater world. And the idea from the Commission, from IMI point of view, is to generate that value for, it says here, for economy and society, and from our point of view, value for patients, value for our stakeholders from the industry side, from the public side. There's a link there. I would encourage you to just upload your results there. Go and have a look and see what other people have done. It's quite a nice website. There's a lot of content already. Maybe some content in your area from other European supported projects. And this is up to you as a consortium to upload results. If you go to the next click, please. There's another related platform called Innovation Radar. And rather than the consortium submitting their results, this is an expert-led platform. And the idea is similar in a way. Is to identify those innovations, those results, those exploitable impacts that projects should have. And again, you know, in this case, an expert would come and look at your project and pick out those few innovations. You know, there's hopefully many innovations that should have a long-term impact. For both of these, both the Horizon Results Platform and Innovation Radar, it's not just a place to park your results and stand back and be happy with yourselves. The idea from the funders, from the European Commission point of view, is that these are a way that you can expose your results to investors. And both the Horizon Results Platform and the Innovation Radar are trying to use their platforms to appeal to investors, and they do indeed invite investors to come and look at the results here. So while again, this is in a pilot phase and perhaps it's not going to have the immediate impact we would want, so it's not something you can rely on to do the sustainability, scalability thing we want. I think this is a very easy first step. And my last slide, the second slide I have here then is on something which is a bit more tangible in terms of expertise and help for you to do exactly what we've described here today. This is called a Horizon Results Booster. This is something you can apply for, and you get some, if you're successful, you get some services, and they're free of charge to you. There's 3 of them. One is on dissemination exploitation, which Kai mentioned, the importance of this, making sure the end user knows what it is that your project is producing and helping you identify those customers. Business plan development, so all IMI projects should already have business plan as part of their deliverables. If not, this is something that will help you develop. But if you already have one, this service will allow you to improve it if needed. The last one is perhaps the most interesting, which is the go-to-market. And I've taken out some of the mini services underneath this that are available. So pitching to investors, IP expertise, innovation management, business, examining exploitation to exploitation, and accessing non-EU funding, so funding outside of grant funding. I can tell you that some of my projects have already applied for these things, and some of them have been successful. And the feedback we have got is that the turnaround between application and result is very short. So it's not you submit something and it goes into a black hole and you're waiting for months. It's a matter of 1 or 2 weeks. You get the feedback and the expertise comes to you and helps you with whatever service you want. So I'd encourage you to look at this at least, and then if you think it's relevant to you, please apply. So my last slide, next slide is my last slide, just on the last bit as we close, just to say there's more information available on our website, the IMI website. We have a special page regarding exploitation project results is there. So the field manual is there. The links to the European Commission resources I mentioned are there, and the webinar recording and slides will be put there shortly after the webinar. And yes, someone's asked, can they share them? Please do share them as broadly as possible. So it remains to me to thank everyone. Thanks Lisa, thanks Magda, thank Kai, thank Nige, thank all of you in the audience for attending this. And we hope that you are as successful as possible in really realizing the impact that your project can have. Thank you very much and good afternoon.